We have another patient here that we're wanting to place an implant right in here, but what on the lower jaw you have a real big nerve that runs along in the bone and it actually comes out right here, and it's going to be where we're going to be placing the implant. So with our CAT scan capabilities, we can actually track and see where the nerve goes, and so what you'll see me demonstrate is to actually track the nerve. Okay, so what we're going to be doing now is the patient's going to want an implant right in this area, and we've got a nerve that runs in the bone and it comes out right in here. And if we're going to place an implant without injuring the nerve, we want to know exactly where the nerve is. And so these three are different three-dimensional images of this one area, and we're going to be able to kind of utilize all three of these images and to help track the nerve. And so if you see this line right here, that's where the nerve is in the bone, and we're going to just kind of slowly track it by just kind of outlining it. So we've tracked the nerve pretty much all the way to the very tip where it's coming out right in here. And now we're going to use this image, and we can actually see it's coming out right in here. So I'm going to go ahead and track it a little bit more so it kind of comes right out of the canal. And I'll just kind of have it so it's more visual. And that's kind of how it looks. Okay. So what we're going to do is take some measurements first, and from here we can tell exactly kind of where we're at, and that's kind of the measurements that we need. And now we can pick out an implant. So we've picked out the size of the implant, we know where the nerve is, and so we can sit here and take a diagram of what the implant's going to look like and actually just place it right where we're wanting to do it. So this is one of the safety factors of having a CAT scan. And the next x-ray I'll show is the implant placed. Okay, so what we've got here is a pre-op x-ray, and you've seen a three-dimensional version of it. And so this is where we're going to place the implant, and we can just kind of go step by step. I make the initial opening, and that's kind of where we're going to place the implant. And I basically use different size diameters of the drill, and so this is kind of how we're going to place, or the area that we're going to place the implant, and just kind of sequential order of, here's the actual implant placed, and we're got it to where the implant is, and that's it. So what we have here is a patient that came in, had a lot of decay, tooth that had the top part of it pretty much missing. All he had was infected root tips in his jawbone, and we were able to, at this office, do the root canal, extract the root tips, and actually place the implant. And the patient didn't have to go to any other offices. The patient was sedated. All the appointments were pretty fast, efficient. We were able to do everything here in the office, from the root canals, making the crowns, placing the implant. Basically, the appointment took the amount of appointments were 3 appointments. He came in, got the tooth extracted, we placed some bone in the area, waited for it to heal up, and then the patient came back and we placed the implant, and all using high-tech instruments and equipment, and we were able to see where his nerve was and go from there.